Patients often ask me, why don't you offer telehealth consultations? And this is my answer. I'm Dr. Samantha Herath. I'm a respiratory and sleep specialist based in Sydney. I've been a respiratory specialist for 12 years. Majority of my working life have been looking after lung cancer, lung nodules, bronchoscopy, and bread and butter respiratory diseases like emphysema, COPD, asthma, and bronchiectasis. When I see a patient in my clinic room, I go through the notes and then I come into the waiting area of my clinic. Then I observe the patient, how they're seated, whether they have oxygen, whether they have walking aid, do they have a wheelchair. When people try to stand up, I can see how much effort they put in. Do they have muscle weakness? Do they try to hold on to the edges of the chair to prop themselves up? In fact, do they actually need someone else to help them stand up? These are all extremely important visual cues that helps me understand the patient, because at the end, I'm treating the whole patient. When I escort my patient to my clinic room, I observe, do they need to stop walking to talk to me? Or are they very breathless when they walk, that they actually have to stop and take a breath just to continue the walk? When they come into my clinic now, they've done this small walk and then wait to see how quickly the oxygen picks up. How quickly do they recover? When they're seated, I ask them what their problem is and I let them speak without interrupting, because conversation matters so much when a patient talks. I can hear when they clear their throat. I can figure out whether the cough is a postnasal drip type cough or a productive cough that's coming from bronchitis. On certain situations, I would actually ask the patient to cough and show me a sputum sample, because the color, the way they cough, all matters a lot into the diagnosis process. Then we go on to the physical examination. I examine every patient from head to toe, because respiratory system is not functioning in isolation. It's always connected to your heart, to your sinuses, to your gastrointestinal system, and the whole body in general. I need that full picture to make a diagnosis. Once I've examined the patient and listened to the story, I make my diagnosis. And realistically, I only need 5 to 10 minutes to make a diagnosis. But my appointment is 30 to 40 minutes, and the majority of the time I spend talking to the patient to find out about the patient. What is the personality of this patient? What are their life circumstances? Are they busy? Are they compliant? Do they understand this problem? How much do they understand this problem? Will they be happy to accept this diagnosis? What can I do better so that they can understand this problem? How can I get this patient to come along this pathway with me so that the patient would implement the suggestions that I give to them? And that is how I get results, the human connection, understanding the patient and personalizing the plan that I have in mind to suit the patient. And that can only be done through a face-to-face interaction. Those visual cues and those unspoken nods cannot be elicited through a telehealth consultation, even if you have Zoom. And then when you think about the logistics of doing these Zoom and telehealth consultations in respiratory medicine, where most patients are elderly and most patients struggle with this new technology. So let's look at the bigger picture. Let's take a step back. If you had to sign an important business contract, would you do it over the phone? If you have a legal matter that you have to sort out that affects your future, would you do it over the phone? Of course not. If you don't look after your health now, you will spend all of your wealth chasing your health, and sometimes later on it may be too late. So this is why I don't do telehealth appointments, because I don't think I can make an accurate diagnosis and do justice to the patient who has placed their trust in me.